That's why you're asking. You're like, how do I hate when. I'm like, don't ask me. 'Cause she asked me, I'm like, don't ask me. 'Cause I don't know what to say.
I don't want bulky fun.
You guys can sit. You're good.
Hello, everyone, and welcome to our first Be Well at Bell Lunch and Learn. Anyone curious can totally sit and enjoy their lunch here. This is open to the public. We have some flyers around on the tables that will give a little bit more information about what's going to be covered today by these two fabulous people. We have Dr. Danielle Biggs and Dr. Dhaval Patel here, and we will be covering some they're going to be sharing a bit of their knowledge about longevity, health, and modern medicine. They are located in NuGen Medical, which is found within Bell Health, which is on the block, right by the basketball courts. So I'm happy to turn it over to them for them to get started, and they'll be available for some Q&A after, and they have another event tomorrow evening in their space that they'll share more information about too. All right, thank you.
Hi, I'm Dr. Danielle Biggs.
I'm Dhaval Patel, physician assistant.
I've been an ER doctor for about 10 years now, and a lot of what we see in the emergency department is people kind of come in crisis. They've kind of let things build up over years and years, and by the time they come to the emergency department, we're kind of putting a Band-Aid on what has been accumulating over time. So Dhaval and I and our partner, Dr. Espinosa, we're kind of like, okay, what else can we do? What more can we do? How could we prevent people from getting here in the first place? And that's how we came up with NuGen. So NuGen is a longevity medicine practice. Does anyone ever heard of the term longevity medicine or know what it is? Maybe you've heard some buzzwords lately like peptides, and we're going to kind of talk about all that stuff today.
So I'm Dhaval, PA. I've been in emergency medicine for 15 years, kind of seeing the traditional medicine route and how it's impacted patients over the years. For 15 years plus, working in 20 different ERs, I've seen how reactive medicine versus proactive medicine can truly make a positive impact in your life as long as you start early. And as Danielle said, we kind of want to outlive our parents, and when I say outlive them, we want to be able to do the things that we love to do even when we're 80, when we're 90. For me, that includes golf and working out and being active and traveling, right? So whatever works for you. Longevity medicine, as Danielle said, is not just pro-aging, it's also improving and making sure you're working on your health span versus lifespan, which is what we'll touch upon during this talk as well. We want this to be interactive, so if you guys have any questions, feel free to stop us. We enjoy that, but I'll let Danielle go into the differences between longevity medicine, functional medicine, and lifestyle medicine.
Yeah, so kind of like what Dhaval started with, when we talk about longevity medicine, we're talking about expanding your health span, right? Not your lifespan. So your lifespan is how many years you're going to live. I want to live to 80, I want to live to 90, I want to live to 100. Our focus isn't that number, our focus is your health span. So you want to live to 80, but you want to be able to go to the gym at 80. You want to be able to travel with your grandchildren. You want to be able to do all the things that you've enjoyed in your 20s, your 30s, and your 40s, but for longer periods of time. So our goal is to optimize your health span and make sure you're getting the most out of the time that you do have. And so a lot of people come in and they'll be like, well, how do you compare to functional medicine? How do you compare to lifestyle medicine? What are the differences between all these terms? So like I'd mentioned, longevity medicine is about optimizing your health span. And the key word here is optimize, right? So we want to get to know you. We want to get to know your family history. We want to look at your biomarkers. We do a lot of labs. We have a 3D body composition scan. The weight on the scale, that number is not the only thing we're looking at. We want to know your goals for the next 3 months, 6 months, 1 year, 5 years. And we look at ways to optimize your health based on what we have to work with now, based on what your comorbidities are, based on your family history, and how can we get you feeling great from years to come. Functional medicine is looking at the root cause, right? So when you talk about functional medicine, you already have something that's going on, something that's not making you feel well, and they're looking at the root cause of what's making that happen. So rather than just treating all the symptoms of what this root cause is causing, it's actually saying, okay, what's the root cause and how can I treat that? And so that's where functional medicine is different. And then you have lifestyle medicine, which is basically like, how can I optimize my nutrition, my working out, my diet, to kind of set the foundation of my health. And those are kind of the differences. There's definitely overlapping between all three, but in particular, longevity medicine focuses on optimizing your health now and for years to come.
So how do we do this, right? Longevity is a buzzword. It's a cool word. It sounds cool, but how do we do this realistically when you come see us in the office? So, all of our appointments are 1 hour long. We take a comprehensive medical history, we review your goals, as Danielle said. And then what we do is we create a personalized plan for you. And that plan is truly personalized. It is not a one-size-fits-all model like traditional medicine. I mean, there's a role for traditional medicine. Don't get me wrong. I practice traditional medicine day in and day out. But there's a role for longevity medicine as well, which is personalized and more so proactive. And we do that by using peptides. Peptides is huge. It's a huge buzzword. Not only that, but it's somewhat gaining more popularity over the past 5 to 10 years. We do that by also replenishing and replacing bioidentical hormones that the body starts to lack as the decades kind of go by. We also do that by utilizing GLP-1s for various reasons, not just weight loss. They have huge benefits when you're dosing them in the appropriate way based on what your goal is. We also do that by using a 3D body composition scale where we want to make sure that treatments are actually working. We just don't want you to feel good. I mean, we want you to feel good and look good, but we also want the numbers to show it, right? We have objective data to show that what we're doing actually works. Because if it doesn't work, we're going to change it and we're going to go back and dose it appropriately, or even change you to something else. Again, it's not a one-size-fits-all model.
And just to go back to a little bit to what Dhaval was saying when he mentioned GLP-1s. GLP-1s get a lot of hype. They get a lot of negative connotations. Weight loss, massive amount of weight loss, hair loss, gaunt faces, Ozempic face. You hear all these terms and you're like, oh my God, why would I ever want to take a GLP-1? But there is so much more to GLP-1s in terms of longevity medicine that goes far beyond the weight loss. GLP-1s actually play a huge part in cardiovascular health. For instance, for women, they get cardiovascular disease a lot different than men. Men get cardiovascular disease from plaque rupture, while women actually get cardiovascular disease from inflammation around their heart and within their blood vessels themselves. And GLP-1s have huge anti-inflammatory properties. So they actually decrease that inflammation around the heart and within blood vessels. So besides the weight loss, which of course is important in terms of insulin sensitivity and your glucose, but really it's protecting your heart for years to come. Women in particular, as we age and you go through perimenopause and menopause, your estrogen levels completely tank. And estrogen is very cardioprotective. So once you start going through perimenopause and those estrogen levels start to go down, you'll notice some insulin resistance, your glucose will go up a little bit, you'll start gaining that kind of visceral fat around your abdominal area, what puts you at risk for cardiovascular disease and even more insulin resistance. And you lose that cardioprotection that estrogen provides for your heart. And so when we talk about longevity medicine and optimizing women's health in particular, we frequently use things like GLP-1s in micro doses just to protect the heart. So microdose, another huge buzzword in terms of longevity medicine right now. What does that mean? Microdosing means giving a dose that's not affecting your weight, but it's protecting your heart, it's decreasing your cholesterol, bringing down your A1C, making you more sensitive to insulin and things like that. So that's a reason, like a particular example of how, quote unquote weight loss drug is actually used to optimize your health and protect your longevity for years to come.
So if she's going to talk about estrogen and progesterone, it's only right that I talk about testosterone, right? So not only women's health, but I've taken an initiative to kind of learn everything about testosterone and men's health, which we also specialize in. So when dosed appropriately, testosterone is a great drug. Recently, if you guys aren't aware, the FDA actually created a panel to help spread the word on safe testosterone use and its benefits. Because for decades, it was being used, abused. It still is in the wrong hands, but they are shifting the attitude towards testosterone to be more so positive, and I'm riding that wave. We safely dose testosterone at NuGen. Testosterone is an important hormone that kind of acts from head to toe, and when it's low or when you do have root causes that are causing low testosterone, it can cause various symptoms that can be debilitating in some cases, and you have no idea what's going on because they're so non-specific, right? It could be anywhere from fatigue to low libido to no energy to no motivation to even depression and mood swings, and there's so many other things that you could literally diagnose the patient with unless you're treating what's actually causing those symptoms. So we also kind of specialize in testosterone and testosterone dosing, and we do it safely by using our labs, 100 plus biomarkers on a regular basis, and I have a whole checklist of things that we go through before testosterone is prescribed as well.
And just to kind of harp on this cardiovascular protection, because cardiovascular disease is the #1 killer of people in the United States. And testosterone is actually cardioprotective as well. So having low testosterone could actually affect your metabolism and put you at higher risk of cardiovascular disease. So when we're looking at you and we're talking about longevity medicine, we're kind of building from the ground up, right? You have to optimize the foundation before you can add things on. So a big mistake that people make in longevity medicine is like, oh, I'm going to go on peptides and I'm going to feel amazing and I'm going to be healthy. Peptides work amazing, but only when you have a strong foundation. So a lot of what we focus on is how do we optimize and build that foundation and then add these things in order to build muscle and give you more energy during the day, better sleep at night, continue to do the things that you enjoy doing. Another big thing that we talk about, and we got a lot of questions about, are NAD and glutathione, another big buzzwords in the longevity world. So what are these things? So NAD is actually a coenzyme. So every cell in your body has to have a reaction that produces energy and makes processes happen. And in science,
the Krebs cycle from biochem, guys, remember that?
If you didn't like science, unlike us, and you might not be familiar with this, but we've done a whole lot of science. And the medical buzzword for energy is ATP. So in order for your cells to make ATP and do all of these processes, you need NAD, which is a coenzyme. And as you age, when you go from 20 to 40, you actually lose 50% of the NAD you had before. And by the time you're 60, you have 20% of the NAD in your cells that you had when you were 20. So it's actually a normal part of aging for these NAD levels to just continue to decrease. Everything happens a little bit more slowly. That's why we age. That's why we have less energy. That's why everything we do requires more time or more effort. So NAD is a huge treatment that we use at NuGen, and we're basically just repleting your cells with something that already is in your body. And it's making all of those processes occur more efficiently. So people will feel a lot more energy during the day. It speeds up your metabolism. It helps you with sleep at night. You'll hear a lot of people talk about how they've been on GLP-1s and they've kind of plateaued. NAD is a great addition where you can optimize your dose of your GLP-1 for weight loss and metabolism without increasing the dose and getting those nasty side effects of nausea and vomiting and fatigue. And so NAD is really, really important for your body and a great way to kind of naturally replete what you already have and get the most out of it. Glutathione, another buzzword. Glutathione is actually an antioxidant, once again, in your body. When you take things like Tylenol, it actually naturally depletes your glutathione levels. So when you're supplementing with glutathione, you're just providing your body with more antioxidant. It helps with your immune system, once again, helps with your metabolism, your hair, your skin, your nails. You're just giving back to your body what it already has, but it has just decreased over time with the aging process.
Similar, same thing to peptides, right? So we'll go back to peptides. So how many of you know that Ozempic is an actual peptide? So yeah, Ozempic is a peptide. Peptides are naturally occurring amino acids that are in your body, but as you age, just like the NAD, they diminish, the pathways diminish, the receptors diminish, the signals diminish. And what we're doing with peptides, essentially injecting synthetic material that's already naturally occurring in the body to kind of tell the body to keep doing that. Don't just stop doing that only because I'm 40, 50, 60 years old. And we have various peptides. Peptides can, improve skin, hair, and nails, as well as improve muscle mass, lean muscle mass, reducing visceral fat. We also have peptides, very popular peptides like BPC 157 for tissue healing, musculoskeletal injuries like tendon repair, tendon injuries. We've had clients who can't afford to be out of work for 3 months actually avoid surgery because they're able to use peptides for 3 months. If it's dosed appropriately and with close monitoring, we can have those positive results. And it's true, we have clients doing it. We're almost 7 months in now. We have clients that have avoided surgery as well.
So why do we want to use peptides to build muscle, right? And a lot of people will think peptides has to do with bodybuilders and people wanting to build all this muscle. And, muscle is very, very important. You should think of muscle as like another organ in your body. And it's one of the most vital parts of longevity medicine. And so when we do body composition scans, we're looking how much muscle do you have? How much muscle are you building? So we actually have a 3D body composition scanner, and all of our patients get complimentary 3D body composition scans every single month because it's a very important part of your health and monitoring your progress. Our scanner it spins you clockwise, and it measures the circumference of your arms, your legs, your waist, your chest. Where are you building muscle? When you build muscle, you increase your sensitivity to insulin, you increase your metabolism. We also look at things like grip strength, right? Your grip strength is going to tell you what your functionality is going to be in the next 5, 10, 15, 20 years. So these are all little things that we look at and we do at the office to say, okay, where are you at? How do we optimize this? And how do we improve this? So for instance, people will come to us and say, for instance, we have a lot of police officers who will come to us and be like, my job is very grueling on the body and I can't keep up with the younger guys in the force. Like, I need to be strong. I need to be able to maintain the muscle. I'm doing exactly what I did before. I'm going to the gym. I'm doing all the same workouts, but I'm not getting the most out of it like I used to. I'm not building that muscle that I used to keep up with that. What can I do? And that's when we talk about peptides that help with building muscle because muscle is so important to your health.
And what we do at NuGen also, it's a comprehensive approach, right? So if we're fixing one thing without taking the whole body into account, you're not going to get the optimal results, right? For an example, testosterone especially, if we don't work on weight and truncal obesity and we just prescribe testosterone, you're not going to get optimal results like you would if we do both together, right? Because a lot of fat will turn the testosterone into estrogen, and if we don't work on both, you're not going to get the results you need. So it's important to take a comprehensive longevity approach to these treatments as well.
Yeah, for sure. Any questions so far?
It's a lot of information we just threw your way, but let's kind of open it up to the floor.
And we can touch a little bit on biomarkers too. Another big buzzword we hear and talk about in longevity medicine. You'll see a lot of ads on Instagram. We check 100 plus biomarkers. What does that mean? We can test all the labs in the world, but if you don't know what they mean and how to optimize them, they're just a bunch of numbers. And so when we do your blood work, we're not just looking at your regular blood work that your primary care doctor will order for you. We're looking at markers for cardiovascular disease, insulin resistance that are going to show way before your A1C does, right? So when your A1C is above 5.5, you're considered, I'm pre-diabetic, right? but we're looking at things like your high sensitivity CRP and your apolipoproteins. These are markers that change way before your hemoglobin A1C will, way before your cholesterol levels will. And we'll say, okay, these are a little elevated. What are we going to do now just so you don't become that? You know, your apolipoproteins are really important biomarkers. Your little lipoprotein A tells you your risk of cardiovascular disease, but it's more has to do with your genetics. Where your apolipoprotein B is something that you can actually act on and change, and is a great marker for risks of cardiovascular disease. So that's kind of what makes our blood work and our biomarker testing a little bit different. And it's something that we actually monitor for our patients every 3 months because we want to see those changes. We want to see those cholesterol levels go down without going on a medication like a statin that has a lot of side effects in itself. Another thing we do at NuGen is that, you know, as Dhaval had mentioned before, is your plans are very personalized. So everybody's body is a little bit different. Everyone's goals are different. Your goals today are going to be different than your goals in 6 months. So we also talk about vitamins and supplements that are going to complement your care and the medications that you're on. So for instance, all women who are perimenopausal or menopausal, they should be on trimagnesium, vitamin D3, K2, and omega-3, right? And why those? So vitamin D, everyone knows about vitamin D, right? Most of us, our vitamin D is usually low when we get our blood work. But vitamin D actually plays a crucial role in terms of inflammation in your body, in terms of your metabolism. And so people just supplement vitamin D. And vitamin D helps you absorb more calcium. But the thing is, you could actually absorb calcium in wrong places, like your blood vessels, where you don't want to. So you should actually take vitamin D3 with K2, and K2 makes sure that calcium gets absorbed into your bones where you really want it, right? Omega-3, as we age, our cholesterol levels are going to go up. So your omega-3, your fish oils, that's going to help with your cholesterol. And your trimagnesium. So what's trimagnesium? It has 3 different types of magnesium in it. So one is replenishing like the electrolyte magnesium that you need, the element magnesium that you need in your body. One is a magnesium that's great for your gut health, and the other magnesium is great for sleep, which a lot of people have issues with as we age, and our circadian rhythm is affected by your hormonal changes and your hormonal imbalances. So all your plans are supplemented by, you know, your biomarkers that you're monitoring, 3D body composition scans that are giving us a true picture and not just a number on the scale. Things like I said, like grip strength, and your vitamins and supplements.
Yeah.
You have a question?
Go ahead.
Yeah.
Go for it.
So talk about the idea of like longevity versus, hi Ming. How are you? I just texted you. Hi everybody. God, that was very intimidating. Talk about like the anti-aging and longevity versus this idea and like the whole other side of, 20 and 30-year-olds trying to prevent the natural aging process. I am really, really obsessed with crushing the socialization of how particularly women are meant to like look like they're 30 until we die, and I'm really not about it. Like, this is what 58 looks like. So can you talk about that from the place of everybody's pushing NAD, testosterone, you should be on hormone therapy replacement, and I've been taking vitamins and doing all the things and lifting weights for a long time to help those things, and I'm so skeptical about all the additive things that people are trying to sell me that I don't buy. I have an 85-year-old mother that could run circles around most people in this room, and she doesn't do any of those things.
100%, right? And as actually somebody who's 85 now is a lot different than what I could possibly look like at 85, right? So when we talk about levels like testosterone, it's a really good question because we have like young people in their 20s come to us and are like, could we have testosterone? I'm like, absolutely not. Absolutely not, right? So people are trying to capitalize on these longevity medicine buzzwords and peptide buzzwords for the wrong reasons. And that's why it should be, when you're talking about longevity medicine and all of these type of things like NAD, glutathione, peptides, your care should be monitored by a doctor. I'm sorry, I've gone to 4 years of medical school. I have an MD after my name. I did 3 years of residency and ultrasound fellowship. I've done tons of continuing medical education. I teach. I'm a assistant clinical professor. Like, I've seen the worst of people in the emergency department. I've seen the best of people. And so I know firsthand what works, what doesn't. I know what it looks like to not take care of yourself, and how you end up from, family members and patients I take care of every day. And
No,
right.
you should. Yeah.
Or should I not be?
So I definitely understand the question. So when you say we want to look like you're 30 when you're 60, that's not our goal. So that's definitely not our goal, right? However, what our goal is as a longevity practice is to be able to do the things that you're doing in your 30s and 40s when you're 60 and 70. Right, two different things: appearance versus how you feel inside, and the ability to live your life how you want to live your life. That's how we want to do it. And NAD may not be for everybody, or testosterone may not be for everybody, right? That's why we need to see what your goals are, what your levels are, dose it appropriately, and it may not be long term, right? If your body's going to treat you how you treat your body, right? Exactly. So that's why it's a whole comprehensive approach, and it's not just a one-size-fits-all model where I could easily prescribe testosterone to somebody who has a testosterone level of 250, but their BMI is also 40, right? To me, that's not fair. That's me doing the patient wrong. And I think that's what you're alluding to if I answer the question.
I'm not even really alluding to anything. I'm just sort of curious as to where you guys find the balance, really, because obviously, love it or hate it, everybody needs to make a living. We all know how the medical industry and health industry work together, and sometimes not so well together. So I'm curious to just, hear, because I trust, that you guys are coming from a very authentic place, how you balance that with people, because I can tell you, I bet you get droves of women like me that are coming in trying to stop the aging process. And how you manage people, because it's like a mental health thing, it's a physical health thing. It's it's gotten really complicated, and so I'm just curious. And I really appreciate everything you guys are doing and all the information you share.
I
It's been
also
great.
think anti-aging and longevity, they're two different things. Yeah, they're two different things.
Yeah. No, I love the question because, like I said, we get a lot of people who come to us for the wrong reasons. How do we balance it? I say no. So I have had people come to me and say, I've researched this and I want this for this. And I just say, I don't agree with that. If you're not optimizing this, then that's not going to give you any benefit. I need to be able to sleep at night, right? So as trained in emergency medicine, we take care of people with no insurance, the homeless, every walk of life we take care of. And we practice medicine so authentically because we truly care about taking care of people, and we've extended that into our longevity practice. So I am very honest. I had somebody come to me and say that they had a child who had surgery and they want their teenage son to heal faster. And what can we do for that? And I said, I'm a mom. I have 2 kids. I would absolutely not do anything for your son. It's not. I said, sure, I can sell you things and make money, but that's not what I'm about. I'm a doctor. I went into medicine because I want to take care of people. I want them to feel good and be able to enjoy the life they had and the people that they enjoy. And so we say no. If your goals don't align with our goals and our practice of medicine, it was nice meeting you, but that's not what we're going to do. Our consults are free for that reason. We really want to get to know. So yes, all of our consults are free because we may not be for you. You may not be for us. We want to get to know you. We want to know what your goals are and see if we are the right team to optimize your health. So we balance the ethics of it and the anti-aging it by saying no when it doesn't align with our ethical principles. We're not trying to keep you forever young. We're just trying to keep people, my mom watches my little children and I want to keep her healthy so I can continue to do the things I love with her and see her watch my kids grow and enjoy her time with them and not be stuck in a wheelchair. So my goal is, when I think about my patients and how I take care of people, I think about how I want to see my family age and I want to keep my family around to do the things that we enjoy, and that's how I treat my patients.
To add on to that, before NuGen was founded, my father broke his hip at 65. He's 5'10", a healthy guy. He should not have broken his hip. So if there was a longevity approach to his health care, I guarantee he wouldn't have broke his hip at 65 from a simple fall. So that's my goal, right? Like, I don't want to break my hip when I'm 65 just because I didn't take the steps needed when I am 65, and now he can't work. So yeah. So there is a lot of pro to this.
Yeah. And I think kind of talking about bone health is really important. Bone health is a huge part of longevity medicine as well. And so when you have low testosterone in men, it actually puts you at risk for osteoporosis and fractures, just like Dhaval had said about his dad. When women go through menopause and perimenopause and those estrogen levels drop, they can have higher risk of hip fractures. And when people break their hip, their quality of life, unfortunately, they're never the same. And we see a lot of that in the emergency department, tons of bounce backs for people after falls and hip fractures. And so hormone therapy for women is not about vanity. It's protecting your cardiovascular health, and it's protecting your bone health and preventing those falls. Well, not preventing falls, but preventing fractures if you do fall. But building muscle, once again, your organ for longevity is so important, because the stronger your muscles are, you're less likely you are to fall and get hip fractures and the comorbidities that occur. When you're hospitalized for something, unfortunately, there's so much room for things to go wrong. When I work in the emergency department, the older my patients are, the more I try to get them out. Because I know once they're hospitalized, they become deconditioned, they catch viruses in the hospital. So those 90-year-olds, and trust me, there's even 103-year-olds walking around and looking great around here. When they come in and they look good, I want to try to get them out. I don't want them to be in the hospital, because I know the longer that they're here, the longer they're immobilized, the more exposure they have to other people and viruses, the more that's going to take a toll on their health.
Never miss a leg day, essentially, is what you're saying.
Yeah, never miss a leg day.
Thank you for that question, though.
Yeah. Any other questions? Just to touch a little bit about peptides too, because I think kind of talking about the ethics of things and what to use and what not. So kind of like Dhaval talked about before, peptides are little proteins, right? And proteins tell or act as messengers in your body, and they tell your body to do different things. So when you're talking about peptide therapy, you're talking about, okay, what messages do I want to send my body? Do I want my body to heal better? Do I want my body to build muscle better? And we talk about building muscle, we're not talking about building muscle to be a bodybuilder. We're talking about building muscle not to fall, to be able to lift your groceries, to be able to unpack your car, to be able to pick up your grandchildren. These are the type of muscles that we're talking about, and the type of muscle that we want to help people build. Another thing is people talk about peptides and growth hormone and stuff, so I want to talk a little bit about that. So everyone has an anterior pituitary gland, and your anterior pituitary gland produces growth hormone. And that's why people gain weight and grow. And when you're younger, you have much higher levels of growth hormone, and that's what helps you grow and develop. And as you age, your anterior pituitary gland naturally produces less growth hormone. And that's why it becomes more difficult to build muscle. It affects your circadian rhythm with sleep. It affects how much you get out of workouts and your energy during the day. And so when we use peptides to stimulate your anterior pituitary gland, we're stimulating it to just make more of what you're already making and do it more efficiently. And that's how we get you to get more out of your workouts, to build more muscle, improve your metabolism and health. So your peptides are not doing anything artificially. They're just telling your body to do the things that it already does, just helps it do it better, sends stronger messages and signaling.
And I wanted to touch base on this when we were talking about the biomarkers. Traditionally, even working in the emergency room, we look at lab values and we're told a reference range, right? That's a one-size-fits-all model approach where if you fall in this range, you're considered normal, you go home. With the longevity approach, slightly different. Even though there's a reference range on your biomarkers, our goal is to optimize that number for you and your goals, right? For your age and what you want to do and where you want to go. That's a difference in longevity medicine versus traditional medicine as well.
Any questions so far? Yeah. I know, and I love questions. It makes it so much more fun.
There's somebody here.
I'll come up here.
Yeah, ask. We love questions.
Hi.
Hi.
From a longevity standpoint, do you guys help manage stress hormones and how that affects the longevity of like your life and your health? Because some of us can't avoid stress jobs. You know, quitting your job to lower your cortisol is not really an option for some people. Is that something that you guys would manage in your practice?
We're hiring. I promise you it's less stressful than that.
Yeah, the law firm life is not easy.
No, you're 100% right. So cortisol is a huge hormone. It's a cortisol hormone in your body, right? And elevated levels of cortisol actually affect your other hormones in your body. It affects your metabolism. It affects your sleep. So when we talk about biomarkers, we do look at cortisol levels, and we look at different ways to how to fix that. And it's hard for me to say this is what we do for elevated cortisol levels because everybody has elevated. If you do have elevated cortisol levels, it's for different reasons. So it's kind of getting back to the foundation of, okay, what about you is triggering it, right? And what about your stress? What about your life? What about maybe your diet? That could be triggering extra stress, or your sleep that's triggering extra stress. Maybe you're not getting enough rest at night and it's making work more stressful for you during the day. So when we have our consultations, it's so much of kind of getting to know you. What's your sleep like? What's your diet like? How often do you exercise? What's your sexual health like? We talk a lot about sexual health in our practice, and it's a very taboo topic that people kind of feel, not taboo, but awkward about talking about. And it's such an important part of your health. It's an important part of stress relief. So it's just kind of another thing that we talk about. And so we do deal with a lot of patients who have different stressors, and we try to address not only your biomarkers, but what the root cause is, what your everyday life is like, and how we can kind of customize your plan to optimize that.
And we also want to make sure metabolically that cortisol level isn't elevated for some autoimmune reasons, right? Or is there a lack of motivation, lack of energy, lack of, from a psychiatric? So like there's multiple reasons, as Danielle said, and we're trying to figure out that cause of it and try to help manage it from that standpoint.
Yeah. Could it be your thyroid, right? A lot of people are not optimized on your thyroid medications, and if you're optimized on your thyroid medications, nothing else is going to work well. It's going to affect your other hormones. It's going to affect your metabolism, your weight, your sleep. So these are all things that we kind of look at when we're talking about how to optimize your personal health.
And we could give you a doctor's note to get you out of work for 2 weeks.
Thank you so much for answering the question.
No problem.
That'll reduce your cortisol levels. Right behind you.
Hi, how you doing? I just have a question. I'm struggling with an issue. It's called bladder control. I've get up 3 times a night, almost every night, and sometimes I don't even drink that much liquid at night, and I still have to get up. What can be the issue, and what can I do? I mean, of course, to resolve that problem, because it's just annoying trying to get up 3 times a night just to go to the bathroom, and I don't even drink that much liquid at night. So, yeah, well, I do. My PSA level.
Good.
Getting to that, my PSA level is always high. Now, my thing is this: is that I've actually gotten, of course, biopsies. I got MRI with contrast done, all of that.
HIPAA's right out the window here.
Right, nothing, but no cancer. It's no
not
cancer.
on our side, okay?
Yeah, I know. That's something. That's urology, right? But that's no cancer. But my PSA is always high, though. I mean, it's naturally is always high, but there's nothing there. But like I said, I always talk to urology, and I don't know. Sometimes I don't really get a clear answer.
Okay.
On how to really, control that, or
So-
what can I do to try to prevent from actually? I don't know.
So I can give some ideas and suggestions, not official medical advice. But the reason why you're probably urinating all night long is because your prostate is enlarged. So as men age, your prostate gets larger, and what happens is it blocks the outflow tract of urine. And so you're not completely emptying your bladder because your prostate is so large that it's blocking that complete emptying. And so the urine will kind of sit in your bladder and it'll kind of dribble out. And so you get a little bit out at a time, and you're still retaining. The problem with that is that when urine sits in your bladder, it actually puts you at a higher risk of infection and prostatitis. So things like Flomax, which will cause you to completely empty your bladder, can frequently help that. So I would talk to your urologist about some Flomax. Another
Diet-
Dhaval will say.
There could be underlying other things too, not just to do with the urological system, like diabetes could do it as well. So it's important that they're checking everything.
Yeah, there's a lot of sugar in your urine. It's going to cause you to urinate more. So people have frequent urination when their sugar's high. So another important thing to check.
Can't write your name on the wall anymore.
All right, so I guess we can kind of end with what does a typical appointment with us look like, right? So basically, you make up an appointment for a free consult. It's about an hour of scheduled time that's carved out. And we really just want to get to know you. We want to know your family history, your medical history, any kind of blood work you've had done in the past, and what your goals are. What your goals are today, what your goals are in the next 3 months, 6 months, what your sleep is like, what your diet is like, what your exercise is like. Are you getting enough protein? Supplements, vitamins and supplements are super popular right now. So we have many patients who come to us with like 20 different vitamins and supplements that they're taking. So we like to kind of go through that. What do you actually need to take? What's helping you? What can actually be too much? So we go through all those type of things. We do all the blood work right in office. So our office is right in here in Bell Health. We do all the blood work right there. We usually have most of your results within 24 to 48 hours. We review everything with you. We have actually a whole biomarker guide that goes through everything that we test, what that means, what your optimal levels are, what your levels are, so you can kind of see. Because we're given all these numbers, and like I said, it's nice to have a whole lot of information. But if you don't know what it means and you don't know what to do with it, it's not really helpful, and it goes and sits in your drawer of your house, and you never really think about it again. So we go through all that stuff with you. We talk about what the different levels mean and what that means for you. We get you to hop on our 3D body composition scanner. You go for a spin. It gives you full reports with, like I said, the circumference of your arms, your legs, your chest, your waist. It looks at things like your waist to hip ratio, and that's really important because that takes into account visceral fat, right? And that visceral fat around your belly, that's what puts you at risk for cardiovascular disease and insulin resistance. So we care about that waist to hip ratio and that visceral fat around your stomach. And so when we're looking at numbers, we're looking at your body composition. That's what we want to see improve. Not a number on the scale, your body composition. We want to see that muscle mass increase, right? We want to see that visceral fat in those high-risk places decrease. And then we come up with a customized plan for you. You're not locked into anything that day. We send you a follow-up email, which basically summarizes everything we talked about, gives a bunch of suggestions. We've created handouts and educational sheets on everything that we offer. So our emails always have a whole lot of attachments with a lot more information, and then we kind of take it from there. All of our patients get monthly follow-up visits. They have unlimited access to us, so you can email us, you can text us through our app, through our phone number. And we're here to support you every step of the way on your journey to feeling your best.
Thank you for having us. It was a pleasure.
And we'll stick around if you're shy and you want to ask questions up here.
Thank you for joining us. And if you didn't grab a coffee or tea over here, feel free to help yourself. And I just wanted to see, do you guys want to mention your event tomorrow night?
Check.
Yeah, so we're having an event tomorrow night with JECT. So JECT is an aesthetics place in Shrewsbury. They have sites also in Miami, in LA, and they just opened in Shrewsbury. And actually one of the PAs who works there went to PA school with Dhaval. Is a very good friend and an awesome person and actually an educator. So they asked us to kind of do an event with them to talk about, feeling good from the inside out. What can we do to optimize your health and how good you feel inside? And then for those of you who want to actually look younger, yes, there's nothing wrong with wanting to look younger either, taking care of yourself and feeling good about yourself. Everyone's different, and everyone deserves to feel good and be happy, however that may be for you. And so we're doing an event with them. We're going to talk a lot of educational stuff about, once again, longevity medicine, optimizing your health from the inside, aesthetics from their point of view. We're having healthy snacks, green juices, a bunch of free giveaways, raffles, like 1 month of peptide treatments or NAD from us and things like that. So the event is totally free. You can come by us from 5:30 to 7:30 tomorrow night. You can stop by any time in there, stay the whole time, ask more questions, and hopefully win some prizes.
Thank you. And thank you both so much for your time. I hope everyone enjoyed. My name is Brooke Petrani, and I'm the head of marketing at NBC Studio Plus. If you guys have any questions about all things Bellworks, let us know. And we hope to continue hosting these amazing lunch and learns for you to learn something during your work day. All right? Have a great day. Thank you.
Thank you.
It's at Bell Health. So it's down by the basketball courts. If you're unsure where Bell Health is, it's right next to where the pharmacy is and the basketball courts on that side.
5:30 to 7:30.